your period but you're not pregnant, here is what your body is telling you. Welcome to Talk Health with Nurse P, where we give you health tips in simple and practical ways, right? So today let's talk about missed periods, also known as amenorrhea. Missed period is also known as amenorrhea. And many people immediately think they are pregnant. And once they are not having their monthly menstrual period, they begin to think about pregnancy. But guess what? When your body is stressed emotionally or physically, your body produces what is known as cortisol. When you're stressed physically or emotionally, your body produces what is known as cortisol. Now, these hormones can begin to interfere with your reproductive hormones. This cortisol can begin to interfere with your reproductive hormones and delay ovulation. Now, when there is no ovulation, there is no period. So yes, that stress from school, work, relationship can literally pause your cycle. Now, the second thing that can cause a missed period is sudden weight changes. You're losing weight rapidly, you're gaining weight rapidly, can affect your body hormones. And these hormones can completely stop your cycle or cause it to become irregular, right? Yes. Now the next one, and the most dreaded cause of amenorrhea, is hormonal imbalance. Now once that word is mentioned, every female, every lady, her heart begins to skip. Now, hormonal imbalance, conditions like PCOS, that's polycystic ovarian syndrome, can cause a missed period or irregular period. Now, there are other hormonal issues like the thyroid problems, which can also disrupt your cycle. Now, the next thing is excessive exercise. Yes, you heard that right, excessive exercise. So too much intense physical activity can especially impact on your menstrual cycle. Too much physical activity, especially when you're doing it without proper nutrition, can stop your period. And this is very, very common in people who are athletes or people doing extreme workouts. Yes. The next thing is medication and contraceptive. Now, for ladies who have indulged in the use of contraceptive, would always find their periods coming irregularly. Yes. So certain drugs like hormonal birth control can delay or stop your period. The next thing is chronic illnesses. I know many people do not really know that if you are diabetic, you're likely to have a shift in your period, which can result in amenorrhea or missed period, right? Yes, diabetes, or you have a severe infection, mostly sexually transmitted infection, can actually disrupt your reproductive hormones, which would cause a delay in ovulation. And when there is no ovulation, there is no period. And the next thing and the last is perimenopause. Now the reason why it is perimenopause is because you have not actually reached the age of menopause. That's if you're approaching your late 30s or 40s, your hormones can begin to fluctuate, your reproductive hormones can begin to fluctuate and prepare your body for menopause. So most times you would find yourself missing your periods, right? It will actually skip for some days, right? Now, at what stage do you get to worry? At what stage do you get to worry? Now, you get to worry when you've missed your period for 3 months or more. Yes, it's a cause for concern. Or there is a sudden cessation, like the period just suddenly stops. Or you experience symptoms like excessive hair growth, unusual discharge. It is a cause for alarm. Right? Or you also experience severe acne. Yes. or experience severe pain, it is a cause for alarm. Now, what do you do when you experience this? What do you do? Number one is to manage stress. Remember, we mentioned that stress is a key factor when it comes to missed period, right? So you help to manage stress, reduce the stress you undergo. If you're working, try and find the time to rest. If you're a student, try and find the time to rest. And please, don't allow anybody's son to be the reason why you're stressed. For those of you that are in a relationship, do not be stressed, right? Because this can actually impact in your reproductive organ. The next thing is to maintain a healthy weight. Now, we mentioned that someone gaining weight excessively and rapidly or losing weight rapidly can be at risk of a missed period. So you have to maintain your weight. Eat adequate meals that contain the adequate nutrients that your body requires, right? And then avoid extreme dieting. Too much dieting. All you these people that go to gym, I'm on a diet. Too much dieting and over exercising can actually impact on your reproductive organ. Another thing is to track your menstrual cycle, because I hear many ladies say, I don't know my menstrual cycle, I don't know when I'm ovulating, I don't know when I'm having premenstrual cramp, I don't know when my period is almost coming. It's very funny and very archaic to find a girl in the 21st century that does not know how to track her menstrual cycle. How would you know when something is actually wrong? So the best thing to do is to track your menstrual cycle regularly. Know the changes that your body undergo at each phase of your menstrual cycle. The menstrual cycle has about 4 phases, and you should be able to know how my body reacts to these phases, what happens, right? Now, even if you think you're not pregnant, right, always confirm first with a pregnancy test, because pregnancy can also be the reason for a missed period, right? Now, your period is your monthly report card. What did I say? Your period is your monthly report card of your health. Now, whatever is displayed on your menstrual flow, your period, is exactly how your body is, right? So if something feels off, speak up and get checked. Follow for more real simple health tips that you can trust. Follow Talk Health with Nurse P. Subscribe to our YouTube channel. Turn on the notification button, like our post, drop a comment. Please drop a comment. Share to your friends, share to that lady, share to your class group chat, share to your work colleagues, share to your friends. Let them keep themselves updated with important health tips, right? Because we cannot have a bad country and also have a bad health. You will not be able to survive. So take care of your health, because your health is your power. With that, we'll see you in our next video. Bye.